Welcome to my presentation on what happens in a 70-year-old male when he eats a sandwich and drinks a soda. The first step is ingestion. Here in this scenario, our subject will ingest a sandwich and a soda. When he takes a bite of the sandwich, the process of mastication begins. The muscles of mastication, responsible for chewing, operate at the temporal mandibular joint to facilitate food grinding and tooth alignment. These muscles include the masseter temporalis, medial pterygoid, and lateral pterygoid, which attach to the mandible's rami and perform movements such as elevation, depression, protrusion, retraction, and lateral side-to-side movement. 3 of these muscles are primarily involved in mandible adduction, while 1 aids in abduction. The next step is swallowing. Here's what happens. Bolus formation. Once you've chewed your food and mixed it with saliva, it gets shaped into a ball-like structure called a bolus. When you swallow, this bolus is pushed to the back of your throat and travels into the pharynx. The oral phase ends with triggering the swallowing reflex when the bolus reaches the trigger area at the back of the tongue and mouth. The tongue pushes up against the hard palate to move the bolus into the oral pharynx, where the swallowing reflex is triggered. All the routes that the food may take, except the desired route distal in the digestive tract, are blocked off. The tongue blocks off the mouth, the soft palate closes off the nasal passages, the larynx rises so that its opening is covered by the flap-like epiglottis. During the pharyngeal-esophageal phase, the involuntary pharyngeal-esophageal phase transports food through the pharynx and esophagus. The parasympathetic division of the autonomic nervous system controls this phase and promotes the mobility of the digestive organs, or peristalsis, from this point on. Once food reaches the distal end of the esophagus, it presses against the cardioesophageal sphincter, causing it to open, and food enters the stomach. In the stomach, gastric juices are secreted, including hydrochloric acid and pepsinogen, which turns into pepsin to help break down proteins and create an acidic environment. The stomach muscles then contract to mix the food with these juices, turning it into a semi-liquid substance called chyme. If you've had soda, like our subject did, the carbonation can produce gas and cause bloating. The small intestine is the body's major digestive organ. After food leaves the stomach, it enters the small intestine through the pyloric sphincter and lands in the duodenum. The liver churns out bile, which is stored in the gallbladder. When needed, this bile is released into the duodenum to break down fats. Meanwhile, the pancreas dumps its digestive enzymes, lipases, proteases, and amylases into the duodenum to tackle fats, proteins, and carbohydrates. The pancreas is the only organ that produces enzymes capable of breaking down all types of digestible foods. As the chyme moves through the jejunum and the ileum, these enzymes keep working to break down nutrients. Water and the products of digestion are absorbed throughout the small intestine. Most nutrients enter the bloodstream via active transport through the intestinal cell membranes, while fats are absorbed through passive diffusion. By the time the contents reach the end of the ileum, what's left is mostly water, indigestible materials, and bacteria, which then move into the large intestine through the ileocecal valve. The large intestine is much larger in diameter than the small intestine, but shorter in length. The undigested food enters the cecum and then travels through the colon. Here, water and electrolytes are absorbed. The large intestine absorbs vitamin K, some B vitamins, ions, and most of the remaining water. Feces, composed of undigested residues, mucus, bacteria, and sufficient water, is formed and prepared for elimination. The feces are stored in the rectum until it's time for a bowel movement. When defecation is triggered, the anal sphincters relax and the feces are expelled through the anus. The large intestine is involved in the breakdown of food, absorption, and defecation. Here's how liquids from digestion get into the kidneys for excretion. Following digestion in the small intestine, water and dissolved nutrients are absorbed through the intestinal mucosa into the bloodstream. The absorbed substances enter the systemic circulation and are transported via the venous system to the heart. From the heart, blood is pumped through the renal arteries to the kidneys. In the kidneys, blood flows through the renal arteries into the nephrons, the functional units of the kidneys. Within the nephrons, blood is filtered through the glomerulus into the renal tubules. This allows for the removal of excess water, electrolytes, and metabolic waste products, forming the primary filtrate. The filtrate, now containing essential water and electrolytes, undergoes further processing in the renal tubules. During this phase, additional reabsorption of water and electrolytes occurs, while waste products are concentrated. This process results in the formation of urine. The urine then travels from the kidneys via the ureters to the bladder, where it is stored. Upon reaching a certain volume, the bladder signals for urination, and urine is expelled from the body through the urethra. Here is a graphic of the renal tubules. Here you can see a detailed view of the glomerulus. The body has about 2 million nephrons, and each nephron contains a glomerulus. The primary organs of the urinary system are the kidneys, which are bean-shaped structures located retroperitoneally, just below the rib cage in the posterior abdomen. The kidneys filter blood to remove urea, a waste product of protein metabolism, through specialized units called nephrons. Each nephron includes a glomerulus, a network of capillaries, and a renal tubule. Urea, which is a metabolic waste of protein metabolism, along with water and other metabolic wastes, is converted into urine as it passes through these structures. The functional units of the kidneys are called nephrons, with approximately 1 million per kidney. Each nephron includes an afferent arteriole that supplies unfiltered blood, a glomerulus that filters the blood, a renal tubule that transports the filtered waste to form urine, an efferent arteriole that carries the filtered blood away. Urine then travels from the kidneys via the ureters, which are approximately 20 to 25 centimeters long. The ureters are lined with smooth muscle that contracts rhythmically to propel the urine towards the bladder. The bladder is a hollow balloon-like organ located in the pelvis. It is supported by ligaments that anchor it to surrounding structures. The bladder stores urine until it reaches a certain volume, typically around 500 milliliters, at which point it signals the brain to initiate urination. To prevent involuntary leakage, the bladder is equipped with internal and external sphincters. The external sphincter surrounds the urethra, the conduit through which urine exits the body. In females, the urethra is about 3.8 to 5.1 centimeters long and located between the clitoris and the vagina. In males, the urethra is approximately 20 centimeters long, extending through the penis and serving dual functions for urine and semen expulsion during ejaculation. In this scenario, our subject is a 70-year-old man. In this case, he just happens to have benign prostatic hyperplasia, BPH. In a male with benign prostatic hyperplasia, the process of urination is affected by the enlargement of the prostate gland. Here's what typically happens. Prostate enlargement. The prostate gland, which surrounds the urethra just below the bladder, becomes enlarged due to BPH. This enlargement compresses the urethra. When the bladder fills with urine, stretch receptors signal the need to urinate. The bladder muscles, detrusor muscles, contract to expel the urine. Due to the compression of the urethra by the enlarged prostate, the flow of urine is obstructed. This can make it difficult for urine to pass through the narrowed urethra. The obstruction causes increased urgency to urinate and frequent trips to the bathroom. The individual may experience a sensation of not fully emptying the bladder even after urination. The urine stream may become weak or interrupted. The individual might have to strain or push to initiate urination, and it may take longer to complete. Because of the obstruction, the bladder might not empty completely, leading to residual urine. This can increase the risk of urinary tract infections and bladder stones. In severe cases, the obstruction can lead to acute urinary retention, where the individual is unable to urinate at all, requiring medical intervention. BPH can significantly impact urinary function, leading to discomfort and other complications if not managed appropriately. If a male with benign prostatic hyperplasia is unable to urinate, a condition known as acute urinary retention, several medical interventions may be required. Catheterization. A urinary catheter is inserted into the bladder through the urethra to relieve the immediate retention and allow urine to drain. In cases where urethral insertion is difficult, a suprapubic catheter may be used, inserted through an incision in the abdomen directly into the bladder. There are medications that can be given, like alpha blockers, 5-alpha reductase inhibitors, and a combination therapy. Sometimes a combination of alpha blockers and 5-alpha reductase inhibitors is used for more effective management. There are minimally invasive procedures like transurethral resection of the prostate, laser therapy, and transurethral incision of the prostate. There are surgical options like an open prostatectomy. In cases where other methods are not effective or if the prostate is very large, surgery involving an incision in the abdomen or perineum to remove prostate tissue may be required. Also, regular monitoring and follow-up obviously is a given, along with lifestyle and behavioral changes. Adjustments like managing fluid intake and avoiding medications that exacerbate urinary issues can also be recommended. Improving bladder function, and addressing the symptoms and complications associated with BPH. Thank you for watching, and I hope you were able to glean some useful information and understanding of how our gastrointestinal, urinary, and reproductive systems work together to digest and process our food and drinks that we ingest.